How to tell flu symptoms apart from a cold. Imagine feeling like you've been hit by a truck or just coming down with a mild sniffle. Sometimes it's hard to tell if you have the flu or a cold. Both are contagious respiratory illnesses caused by different viruses, but their symptoms can overlap. Knowing the key differences can help you decide when to see a healthcare professional and how to manage your illness. The first big clue is how quickly symptoms appear. Flu symptoms usually come on suddenly, often within a few hours. You might wake up feeling fine and then suddenly develop a high fever, which can be over 100 degrees Fahrenheit, along with chills, body aches, and a pounding headache. People with the flu often feel extremely tired and weak early on, and this exhaustion can last 4 days or even weeks. In contrast, cold symptoms tend to develop gradually over a day or two. The fever with a cold is usually low-grade or absent, and muscle aches or headaches are mild or rare. Fatigue with a cold is generally mild and short-lived. When it comes to common symptoms, the differences are quite noticeable. The flu often includes a high fever, dry cough that can be severe, and chest discomfort. Headaches and muscle pains are prominent and can be quite intense. You might also experience a sense of exhaustion that makes even simple tasks feel overwhelming. Cold symptoms, on the other hand, usually involve sneezing, a stuffy or runny nose, sore throat, and a hacking cough that may produce mucus. Mild headaches and body aches are common but less intense than with the flu. Duration is another important factor. Flu symptoms can last for a week or more and sometimes lead to serious complications like pneumonia, especially in vulnerable groups such as the elderly, young children, or people with chronic health conditions. Cold symptoms typically last about a week and rarely cause serious health problems, they mostly requiring rest and symptom relief. Additional clues include the presence of extreme exhaustion early in the illness, which is common with the flu but never with a cold. Chest discomfort tends to be more severe and frequent with the flu, while with a cold it is usually mild or absent. Dry coughs are typical of the flu, whereas colds often cause a hacking cough with mucus. In summary, if symptoms hit suddenly with high fever, muscle aches, headache, and profound fatigue, it's likely the flu. If symptoms develop gradually, are milder, and focus on nasal congestion, sneezing, and sore throat, it's probably a cold. When in doubt, especially if you are in a high-risk group or your symptoms worsen, it's best to consult a healthcare professional. They can perform specific tests to confirm whether you have the flu or a cold and suggest appropriate treatment. Remember, proper diagnosis and care are essential to recover quickly and prevent spreading illness to others.